All right, so now what we're going to do is put the inner cannula, the non-disposable inner cannula back in to our patient and finish up the procedure by putting on some new trach ties. So I also had brought a new package of trach ties to the table as well. So I'm going to pick up my inner cannula. I'm gonna put this in. And what I remember on a non-disposable inner cannula, you need to twist to make sure that your two blue dots align with one another. And I'm just kind of checking to make sure that that's not going to trumpet out. And now I know that my nice, clean, patent inner cannula is in my patient. And so now what I'm going to do is I'm going to open up the package of the new trach ties here. I'll dispose of that. And if you are working by yourself, there is a method where you can overlay the new trach securing device over the old one, and then remove the old one so that you always know that you have a secure device. So that's what I'm going to do here. So I have just put my new securing device around the patient, and what I'm going to do is bring this up. Sorry. You can always tighten as much as you need later, okay? So, and you can bring this on the other side. And if you wanted to use your hemostats now, you could, that's a possibility. It's always a little tricky. And do be mindful that every time you're moving that trach, so really minimal movements of the trach, because that's your patient's really feeling that. And now what I'm going to be doing is taking the old one away. So that is one way, if you are by yourself, that you want to, and you can throw that away. Of course, that's disposable. Now, the next thing I want to say for sure is that this would be way too loose. So what you want to make sure is that you want to use the two-finger method of securing the trach ties. So now what I'm going to do is I'm just going to make sure the trach stays in place, of course, but I'm just moving each one of these to secure it. And checking it to make sure that two fingers can slide under, so it's not too tight and it's not too loose for your patient. Always check in with your patient, how does that feel? And get some appropriate feedback from the patient around that. Now, what you can do now is, now what you want to go over to is what is on your supplies over here. I'm just going to motion my patient to move forward here. I am just going to be putting the new trach dressing underneath here and underneath here. You want to make sure you go underneath the flange, because if they cough, this is the purpose of the dressing. And this takes a little bit of finesse to try to make that look nice. But we want to make this look nice. Remember, our patients' families are in the room. Okay. Should you have how does that feel? This is a good time to assess your patient, breath sounds, what do they look like? Are they tachypnic? Anything that might signal to you that you need an intervention. Do you need to suction again? What is it that your patient is requiring? As one of the final notes, if you do have a cuff that is up, you do want to make sure that you are measuring the cuff pressure to make sure that that has been checked on your shift, and so that you can document that. And then beyond that, I'm going to take my gloves off. I can put them in here, put all of this away. That all goes into the garbage. And certainly before you leave the room, you want to make sure that if your patient was on an HME, you want to put the HME back. I would actually use another set of gloves to do that. Or if this is a trach collar, confirm the FiO2. Does the trach collar have enough water in it? Do you have enough suction catheters for the next therapist? That kind of thing. And then you would record the time of the trach care in the patient's chart.